Hals über Kopf. Das ist der Physiopodcast zu Problemen im Kiefer-, Kopf- und Halsbereich und zu deren Lösung. Mit eurer Gastgeberin, Franziska Sies.
So, welcome to the 11th podcast episode on the topic Tinnitus, what is it, what helps, and how physio can support. Today it will be again in English, and today's guest is Michiel Trouw. I need to say it's correct, from the Netherlands. A big thank you for taking the time for this online interview, Michiel.
Yeah.
And Michiel is physio since 1992 and runs his own business in the Netherlands. Since nearly, I think, 14 years or nearly more, he is a Crafta lecturer and is part of the Tinnitus Academy in the Netherlands. Besides that, he has a strong focus on teaching and practicing in his CrossFit box also in the Netherlands.
Mm-hmm.
Did I forgot anything, or do you want to add something to?
I did my master's manual therapy next to that, so
Sorry, I forgot to mention that.
that's also one of the parts that I like to pronounce. And also, I did an extended scope education for physiotherapists, so that you can, in a new kind of thinking, move in between the different healthcare professionals to guide patients with musculoskeletal dysfunctions or, let's say, tendons, joints, muscles, dysfunctions, to guide them through the whole health system, because it's difficult for them most of the times.
But that's mainly relevant in the Netherlands, isn't it? The scope.
No, we have in Norway, in England, in Canada, in Netherlands, Australia,
But not in
these
German-speaking
functions.
Yeah.
Yeah.
But not in the German-speaking countries, isn't it?
Until now, not. I think maybe in the Swiss. I don't know for sure.
Maybe in the future. Who knows? Would be great. Yes.
Yes.
So, how did it come that you kind of had your focus towards head, jaw, and neck, towards function, towards Crafta?
Well, I studied physiotherapy. I started to work as a physiotherapist in the private clinic. I had experiences all over the difficult field of problems and pains and dysfunctions. And then I did my manual therapy. And during that time, I had a presentation of Harry van Piekhaert, where he told us about the important relationship of the jaw in neck patients. And this was for me the first time I ever heard something about jaw-neck relationships. I didn't know anything about the jaw. And this was an invitation for me in the field of head, neck, face, where I knew nothing about. And it interested me huge. And from there, I moved into the Crafta system. I did all the courses there were. And at the end, I decided to move on in this direction.
Which is great.
Yeah, the field is super interesting. It's new to a lot of physios because now you talk also about tongue dysfunctions, mouth, breathing, swallowing, ear pain, headaches, and it's a challenging part of the healthcare.
Yes, definitely. And not only physio, also like
No.
speech and language therapists as well.
Yes.
Yes, like overlapping. Yeah.
Yeah.
So to go back to the main topic, what exactly is tinnitus and how does it develop?
Oh, not the most easy question you have there.
I know.
So tinnitus for the main people means you have a sound in the ear that is not a sound that you want to hear. So it's an unpleasant, most of the times, an unpleasant sound that you hear. And most of the times people around you don't hear this sound. So it's a conscious auditory input to your ear system that only in 95% or 99% of the cases, only you hear. So an external observer, a doctor, for example, or a friend is not hearing the same sound.
Mhm.
And that's it can. If you ask how this can develop, it can be developing in a lot of different ways, that are very, very difficult to describe precise because the brain can play a part in it. The physical system of your body can play a part in it. Damages in your ear system can play a part. So there are a lot of different possibilities how tinnitus can start up.
And also maybe other diseases in the background may play a role. So, which makes it also difficult to treat. If it's like
Yes,
it's
yes.
it's
First, the diagnosis is very difficult, or not. If someone has the sound, yes or no, they hear it very clear, so they can tell you what they hear. But to categorize where the tinnitus is coming from, what it is exactly for kind of dysfunction, and if and how you can treat it is extremely difficult in this group.
yeah, and also to measure it. Because if you have
Yeah.
kind of neck pain and it's kind of
Mhm.
like you look back and the patient has pain and then you treat and do your exercise with them and then they look back and the pain is better, then it's kind of easy for us to measure. But
Mhm.
tinnitus to catch, to really measure is more difficult. So what kind of tools do you use to measure tinnitus?
You can ask for questionnaires. There are few questionnaires that are really good to objectivate how much tinnitus someone has.
Mhm.
You can ask, of course, for a kind of scale from 0 to 10 and ask them just 0 is no sound and 10 is the most loud sound you can imagine as a human being. How loud is your sound or the noise or the buzzing or the roaring or whatever kind of sound they specify.
Mhm.
And then you can objectivate it a little bit like this. And this is working very good between one person before and after, but
Mhm.
not between different persons because everyone is giving different numbers to this tinnitus severeness.
Yes, yes, I imagine. And also like depends how the patients is on this day, if he's happy or she happy or it's kind of a good day or bad day, and then maybe you do the same treatment and the next time you do the same treatment and it has a different effect and you don't know why.
Mhm,
So
mhm.
that's what I experience sometimes.
Yeah.
Yeah. Yeah.
So it's not only a lot of times there's like we talked about already, a lot of involvement of different situations on tinnitus and how fit you are, how happy you feel, what kind of sun is outside, how your sleep was. These things affect your tinnitus a lot of times, so it can be really difficult um, to get this in grip and to really change the tinnitus in patients.
What role in the physiotherapy plays the jaw muscles, cervical spine, and the posture? What structures do you assess in the patient?
So when I see patients that complain about tinnitus, first we have uh, an anamnesis. So we ask them questions about their tinnitus, if it's always there, or if it's sometimes there, sometimes not, if it's in both sides or in one side only,
Mhm.
or central in the brain somewhere,
Mhm.
what kind of tone they hear,
Mhm.
if it's high or low or changing or these things. If specific habits like chewing, rotating the neck, or looking up change the tinnitus.
Mhm.
Um, if specific time patterns on the day or night change the tinnitus. And of course, also if tiredness or stress or uh, stress situations play a big role in the change of the tinnitus, yes or no, because that helps us already a little bit to choose if we have less or more possibilities to work with physiotherapy on these patients.
Mhm. Mhm.
So that's the first part we do in the examination,
Mhm.
the anamnesis, and then if we see enough possibilities to evaluate the patient physically,
Mhm.
we do an examination of the we first ask the patient how loud is the tone now at this moment. So, for example, they say it's a 5 out of 10. Then we do measurements of the face, mouth opening. We look to the position of the teeth and contact points, and we ask constantly on a patient if the tone changes during these exam maneuvers. You have to tell us. That's a very important situation, because if we have, for example, mouth opening increasing the tinnitus and mouth closure decreasing the tinnitus, that's important to know for us.
Yes, then we might first assess the jaw.
Yeah.
Yeah.
So we look for the jaw, the movements, we inspect the teeth and the parodontium, the gums, and we look for the face, the head, and the neck. 2 movements and 2 different points where we can pressure or change pressure and see if this has anything to do with their tinnitus. Sometimes this directly changes the tone, and then we still have to look very good if it's more a somatosensory tinnitus, a tinnitus where there is a strong component from the body that's playing a role, or that is maybe still a patient with a very, very over irritated brain, and therefore having with extra input or with extra movements of the face or the neck or the jaw, extra tinnitus. So it's still difficult to know for sure if we can do something about it, yes or no.
And how many kind of treatments do you give time to, like, do you give them like more 3 sessions, 4 sessions till you say, okay, now physiotherapy is working, or maybe you need to go to a different health professional to have a further look? So how many sessions?
It depends on the decision. So after my examination, that takes most of the times an hour. We sit with the patient and we describe, or we tell the patient what we found in the physical examination, and see if we really have goals in body structures to change. For example, tension of a chewy muscle or a rotation of the neck that's limited and plays a role in the tinnitus. And then we can decide with the patients that we want to treat this. For example, 3 or 4 treatment sessions in a few weeks, and really see what happens with the tinnitus. Of course, the patients get then also home exercises to maintain this this advantage that we give them from the structures,
Yeah.
and we see if the tinnitus is positively changed.
And if in those kind of more or less 3 or 4 sessions it doesn't change, do you think then physiotherapy might be not helpful, or maybe not at that time? I know it's kind of hard to say because tinnitus is subjective, it's hard for us to measure. Despite the clinical findings, we find like limit rotation in the neck or tension in the jaw muscles. But yes, when do you say no?
If after 3-4 sessions nothing changed, then or you redo your physical examination to see if you maybe missed a few things that we still have to clear up, or we have to look further and say, sadly enough, the entrance from the body to the tinnitus is not so easy this time, and we have maybe first do something with sleep, with relaxation, stress management, or even ask a psychologist to help us with the first part of the treatment.
Yeah, because sometimes that's what I experience when I treat tinnitus patients, that not all the time I get an improvement. Sometimes I kind of have like a cutoff, like after 3 or 4 sessions, where I said if in that time there's no improvement, it's a waste of time for both sides. We need to look, as you said, further to different directions.
Yeah, and what is very good is that you use your measurements. So if you see the mouth opening is improving in 3 sessions, but the tinnitus is not responding, then maybe the mouth opening's limitation that was there is not correlated with the tinnitus.
Yes.
So
And why is the mouth opening or the jaw correlated with tinnitus?
It can be, yeah.
Or-
Because there are direct anatomical relationships between some of the ligaments, the bends, and the muscles with the jaw and the middle ear, and also because there are a lot of neural pathways that connect between jaw and ear region, so they can really involve quite easily by movement patterns or habits, an irritation in the ear region.
Yes, yeah. And also the same with the neck, because there's also like connections, face and neck, like the nucleus,
Yes.
cervicalis. Yeah, brainstem.
So neck, head, and face can play a role. You don't get any relationships between your elbow or your knee and tinnitus. It's really upper cervical or neck area and jaw and face
Yes.
or head. Yeah.
Does the tongue play also a role in tinnitus?
Oh, maybe
Play a role. Yes.
I could play, I think, yes, because we know that there are important relationships between the tongue position, tongue activity, and, for example, the mouth floor strength, but also the position of the more backwards part of the tongue that plays a role in the position of the condyle, maybe, and the tension in the masticatory muscles, the muscles where you chew with. So the tongue is also a muscle, easy to access, and also easy to work with, to give exercises for, or to stretch, or to do something with, to change the behavior of the mouth system. So it's a fantastic organ to examine and to work with.
Yeah.
And sometimes it plays a role in tinnitus.
Yeah. Are there any specific exercise what you give to the patients, which is kind of, from my perspective, I think a hard question because it's individual. Because if you have someone with jaw problem causing hopefully the tinnitus, then it might be quite straightforward to work with, and or like reduce strength in the neck area, then you work on the strength. But is from your experience anything which you maybe advise tinnitus patients to to kind of help with cope with the
Yeah,
tinnitus?
you can come for two different directions in this question. So, one, very specific to the tissue that we found connected with the tinnitus in the examination. And then you can, of course, say you have to stretch a muscle that is too tight, or you have to move the neck vertebrae that are too stiff, or you have to train the tongue strength because it's too weak. That is very specific to something that you find as a therapist as a dysfunction. But also, we gave the patients a lot of advice about general movement and going out, walk in the woods, climb a mountain, do something physical actively, because we know that general health and physical activity play a big role in how good your system is coping with tinnitus. And so you can look to two different routes. The one very specific to the tissue that's irritated or playing a role, and the other one to use general exercise, aerobics, something that gives the patient more activity and less focus on the irritation.
Yeah, yeah. That's what I kind of sometimes say also to the tinnitus patients, because like if you want to maybe when you want to get maybe a child, you see everywhere pregnant women, or
Yeah, yeah.
or it's kind of the same. You get the focus too much on them, or if you want to buy a car, you see it everywhere. Yeah,
Yeah.
that's how I sometimes explain to the patients. Yeah, and which leads me to the next question, because what I find really interesting and what I heard a couple of times from yourself is the Tinnitus Academy, which you have in the Netherlands. So what is the Tinnitus Academy to start with? Yes.
Well, the Tinnitus Academy is, I think, one of the best ways healthcare can be. It's an multidisciplinary setting in a beautiful building outside somewhere in the nature, here close by in my home city, where more different healthcare practitioners work together around 3, 4, 5 people that join as a group in a tinnitus program. So these people are in this building for 4 days or 3 days, and the healthcare providers are around them. One is a neurologist, one is an ENT doctor, one is a psychologist. I work there with different colleagues as Crafta-Therapists. We have coaches. So we have different people working around this group. And sometimes they have individual sessions and sometimes they have group sessions. And this is not only about finding a structure that irritates the tone, but this is also about why you are now in your life in a phase that you have so much irritation from this tone. And it's also about motivation, goals, how you cope with time, stress, your work, your private life. And this is now happening for more than 10 years, and the results are fantastic. You see that people really go into this 3, 4 days outside of their normal habits, outside of their normal work situation, outside of their normal private situation. Then you see that the results are good because they really have to dive deep in their reasons why this is happening, and sometimes really change after 3, 4 days. And I think this is not only possible for tinnitus, but also for people with long-lasting headaches, with dizziness. That is not really a pathological situation, but still there after a long time, and maybe for even more pathologies or problems.
Yeah, especially a kind of chronic
Yes.
conditions. Yeah.
Yeah. Yeah.
And you said that most of the people who attended have like a positive effect after the 3, 4 days. How long does it last? Do you have like a kind of like a control after like or like a follow up after 1 or 2 years to see if it still remains that how they got out because the tinnitus is better or the life is better, maybe the tinnitus. Yeah.
So the last sentence was very important. Some of them say my tinnitus went down from a 7 out of 10 to a 2 or 1 out of 10, even 0 sometimes. So this is a group, and there's also a group that says I still have my 7 out of 10, but I don't bother so much about it. It's not so irritating anymore. So these 2 results are there, and we see them again after 6 months, and ask them again, what's happening now? How is your life? How is it going? And some of them also join 1 day or even 2 days a year later to come back with the group and look together how it's going. And we see that the results maintain for longer time.
Which is a great concept. Do you see a lot of cases in physiotherapy with tinnitus which might be ineffective?
I see patients joining my clinic where I really, after one session, can say, this is not something for me. I cannot do something with physiotherapy. But then I refer them or to a psychologist or an ENT doctor or someone else. I also see patients joining physiotherapists that don't know so much about tinnitus and do a lot of massage or general treatments just to trying to help them, but not effectively because it's a different group of patients, and it's also a difficult education that you have to do before you know something about this difficult topic. And I think some of the people skip this and just do massage or whatever to try to help them. And most times with a good heart, but maybe not so effective as possible.
And what are the criteria when you say after one session, no, I rather refer them to an ENT or psychologist because physiotherapy might be not that effective?
When in my anamnesis the anxiety is super high, and or there are really psychiatric or psychologist red flags for me, or yellow flags officially for me, then I refer them to colleagues or to other healthcare providers and tell them, listen, the best way now is first to make sure that you are safe and that you find some basic trust in life in your situations. And then, when it's necessary afterwards, maybe we can do something. Because if I put my fingers in the mouth or do something with the neck in the patient that is really very unstable in psychological profile, then it's a huge chance that the tinnitus increases. And I don't want that.
Yeah, okay. Thanks for that. Are there any recent scientific findings on tinnitus treatment?
I think the only things that really changed in the last years is that we see that it's not an illness from the ear, but much more from an overreacting sensory system in your brain. Meaning that also the very traditional healthcare doctors see and agree about this, that stress, sleep, vitality, maybe nutrition, these things play an important role in how you cope with this tinnitus, and maybe even if you get it, yes or no. So
Also, if you can prevent it with that as well.
yes,
Yes.
yes. So slowly we see a shift from just going to the ear doctor and look how your hearing capacity is, and maybe place an hearing aid to it, is going more in the direction of general healthcare, explanation, vitality programs, sleep, breathing, things like that.
Yeah, which makes sense.
Yeah, yeah.
That's also my experience in my practice. Yeah.
Mhm, mhm.
Do you have any inspiring success stories from your practice?
Well, luckily enough, we have good results sometimes because I try to filter out the patients that really belong to me. And we had for a couple of months a fantastic story of a physiotherapist, a woman of 50 something years, that had a severe tinnitus on one side for 7 years. And she asked my opinion about it, and we could really find one specific muscle under the cheek here that was
Kind of.
yeah,
Yeah.
yeah, that was super tight and irritated, and when we pinched it, it was really causing her tinnitus very strong, and when we stretched it, it was almost away. So we did stretch techniques, tongue training, mouth floor training, and in 5 or 6 treatments, we had her 95% off the tinnitus. And now she only has some small tone left if she is really stressful in her day or when she had a bad night's sleep. So she's super happy, and yeah, it was fantastic story to have so much effect on that.
Yes, I imagine. And does the time play a role? So, like, if was it like a acute situation that you had it like less than 3 months? Do you have the feeling that the longer the patient has the tinnitus, and if it's on one side or both sides, it might have a positive or negative impact on the treatment?
So the time I don't know for sure.
Okay.
Still not after all these years. What I know is that a chronificated tinnitus that is long lasting there, always on. So there's no break in the irritation. And it's on both sides. That is not responding on chewing and movement and activity and sports. That is less easy to treat than a tinnitus that is there for a few months and is only on the right side and only during rotation or during chewing. That is most of the times a little bit easier to grab.
Okay. Yeah.
Yeah.
What common myths exist about tinnitus and physiotherapy? Is there any?
I don't know for sure. Maybe that people think that massage of the ears or of the neck plays a big role in reducing it. Um, uh, so otherwise, I don't know if there are a lot of myths about physiotherapy and tinnitus. I think a lot of colleagues don't know the tinnitus situation very well, and a lot of tinnitus patients will not go to a physiotherapist for their treatment because they probably have their perspective that you have to go to an ENT or to someone else, to a hearing physician or something like that.
When a patient has acute tinnitus, so not long, what is the effective treatment to go with? Is it to get some cortisone? Is it helpful or not? Or because some patients it might be effective, some are not, but where is it effective, where is it not? It's kind of like hard to tell.
I think in the Netherlands they only use this kind of treatment when there is an acute hearing loss at the same time. So if they have the sudden death syndrome at the same time with a tinnitus, then sometimes they give this cortisone or medication like cortisone directly to see if they can reduce the active pathology of this. But otherwise, medication or cortisone is not very successful in all the other tinnitus situations, as we know.
Because in Austria, I have often the cases that I see the patients after they have been treated with cortisone and it was ineffective, and then they will come to my practice. So that's why I asked that question. Yeah. And
I know that one of the professors in the Radboud University in Nijmegen in the Netherlands that really knows a lot publicate about this is against cortisone, because he says if you repeat this a few times, probably the healthiness of your hearing system is going down. And if you somehow need a hearing aid or other techniques in the future for hearing problems, that's difficult after too much cortisone. So he's against it. Only in the fresh inflamed situation where you need something to make that going away.
Yeah. And now a question I wanted to ask actually at the beginning, which I find really interesting. It's what led you to specialize in tinnitus treatment? Because I mean, you told me how you specialized in the head, neck, jaw area, but why specific also the tinnitus is a big theme in your area?
Well, if you go and you know this for yourself, if you work with head, neck, face patients, you will see patients with cancer, with orthodontics, with dizziness, with headaches, with eye problems, facial pain, neck pains, but also you meet patients with tinnitus.
Yes.
And the tinnitus group is impressive because they can almost be or even be depressed by the importance of the tinnitus. It can really reduce their joy in life, and it can play a big role in how healthy they feel in relationships and with connections with other persons. In Germany, you hear sometimes this called the suicide attempts that happening in these patient groups, and they even have a name, I think, for that, to call it Selbstmordkrankheit.
Okay.
So this is not because it's funny to say these things, but people are really depressed sometimes and feeling a lot of anxiety, and that tinnitus is the main important thing in their life. They don't have a lot of other things anymore because the tinnitus is playing the biggest role. And therefore I was thinking, hey, if I can do something about it, and we have now good scientific proof that maybe about 30% of all tinnitus patients have a relationship somehow with the moving system, like jaw, neck, face, then I will play a role in this part if I can. So that was why I was motivated to see these patient groups.
Yeah. Yes, and they mostly are happy about it. Yes.
Yeah,
It's
yeah.
picking up. Yes, of course. Yes.
Yeah.
So now getting to the end of our talk, what key message would you like to share with our audience?
If you have a tinnitus yourself and you are thinking about possibilities, it is maybe wise, especially if you have some relationship with mouth opening or with movements of the neck or positions you are in or sport activities, that you ask a skilled physiotherapist like a Crafta-therapist to examine you. Another point can be a take-home message that it is very, very seldom that a tinnitus is really coming from a tumor in your brain or from something very severe. So anxiety to that point is not so necessary. If you have this anxiety and you still think maybe something really damaging is going on in my brain, ask your physician or your doctor about it, because that's an important question. He or she can most of the times reduce your anxiety by just explaining that most of the times you have other signs and symptoms that belong to really severe pathologies like a tumor in your brain. So this is not very logical that it happens. And otherwise, if you have this condition, it's not easy to solve it, but a lot of people can become better after time. So taking care of your daily life, have a good sleep, do breathing exercises, have some physical activity, talk with friends and family about it. These things really can help outside some treatment from physiotherapists or doctors.
Yes, and not isolate yourself, isn't it?
Yes, that's very important.
So thanks a lot, Michiel, for your time and your input and interesting talk about tinnitus. And yes,
Well, thank you for the interesting questions, and I hope that some people are really like to hear this. And if they have more questions, they can always ask you, Franziska.
yes. And if I can't answer, I will ask you.
You can ask them to me again. Yes?
Thank you. Bye bye.
Okay.